Hi, I'm here to talk to you today about carpal tunnel surgery and cubital tunnel surgery. I had both surgeries done in one day. I'll show you my stitches. There's my elbow. And there's my hand. Both healing up pretty good. So this is day number 12. And I'll be going to get my stitches out in 2 days. And then I'll start physical therapy. I am not working at this time. The job I have, I do a lot of heavy lifting. So surgeon doesn't want me working. And when it comes to lifting, the only thing you really can do is, the lady told me the heaviest thing she wanted me lifting was a coffee cup. Of course, you always are trying to do a little bit heavier, but, try to avoid that. I know I did. So far so good. Now with the surgery, what they do is for the carpal tunnel, okay, there's a tendon, a ligament in there that they release, and then they, move around some fascia, and that's for the median nerve in the wrist, okay. With the elbow, he goes in there. He told me there's a ligament in there he releases, and then moves around some fascia, to give the nerve some extra room so nothing is compressing it. That's what causes the numbness, the nerve being compressed. So he did that in my elbow, so hopefully all that stuff will solve my problem. I was having numbness in my fingers, these two fingers mainly, and a little bit of numbness in these two, but mainly in these two. Then I was having pain like in my wrist and pain in my elbow, and then I would have numbness here. So that's the reason why they do this particular surgery, to relieve that numbness. What I did was I went in to determine that I needed this surgery. I had x-rays, of course, in my wrist and my elbow, and then they sent me for an EMG. And what that is, that's a test. They actually shock you, like in your arm, your hand and stuff, to see how the nerves are firing. And then the second part of the test is they actually pinprick you. They probably stick like a little needle in you, about maybe an 1/8 inch or so, maybe a little more. And then you have to move your hands and your fingers and stuff, to see how the nerves firing. Now that particular part of the test actually hurts, because they're sticking a needle in you, So if you have to have that done, be prepared, because it's a little painful when they do that. So with the surgery, I went in there, put an IV in, asked me a couple questions, and within like 45 minutes, I was actually in surgery. And then, they knocked me out completely with the twilight is what they call it. So I woke up, I was a little bit sore. I had ace bandage around my wrist and my elbow. And then I went home, slept for a little bit, got up, ate a little bit. I was, it was hurting. I had some pain, And then I just went to bed, slept pretty good. But when I woke up, my hand was hurting, like the area, where I had the surgery at. And my elbow was hurting some too, but I was surprised how bad my hand hurt, because the incision is probably only maybe like an inch and a quarter or something, but it hurt. So I, when I took a bath, they tell you not to get the incisions wet, so I put a plastic bag over my arm, taped it. But 2 days ago I did get it wet, so I had to take the ace bandage off and the gauze and dry my hand off. I actually got the hand wet. So I cleaned everything off good. Cleaned the incision, around the incision, with an alcohol pad. I have those little alcohol pads. Cleaned that off good. And then I put the ace bandage back on and the gauze. And so in 2 days I'm going to go back and have the stitches out. And one thing I noticed is, like, my hand is like weak. Like I actually reached for a pillow the other day, and you know, when I grabbed it, like these two fingers, like it actually hurt, you know. These two fingers have actually been sore. Like, you know, this is day number 12. They've been sore. So I'm going to bring that up to the surgeon and ask him about that, you know. But I've been off work, you know, because I do a lot of heavy lifting. So, you know, they told me they didn't want me going back to work, you know. So I'm going to tell them about that, the pain I'm having in my fingers and stuff, you know, because I really can't grip nothing. You know, like I can squeeze. It doesn't hurt when I do that. But like, say if I'll grab something, you know, these two fingers are fine. You know, the peace fingers. Peace and love. Okay, but anyways, these two fingers are hurting, so I'm going to tell him about that. And then he told me he'll be sending me for some physical therapy, you know, to strengthen my hand and my elbow up, you know. So we'll see how that goes, and I'll do another short video to update you guys, see how things are going. So hopefully this video was informational. If you have any questions, feel free to post a comment, and I'll try to answer the best I can, and then we'll go from there. Thanks for watching, and have a good one. Bye.